muna makapag for BS and 1B. So today, I'm going to demonstrate to you the catheterizations in female. Definition, it is the insertions of catheter through the urethra into the bladder to drain urine or instilled medications or fluid. Purpose, facilitates evacuations of urine, obtains a sterile specimen as needed, monitors the urine output, determines amount of residual urine, prevents strain on pelvic or abdominal wall from distended bladder, and empties the bladders before and during surgeries and before certain diagnostic. Equipment, two-way Foley catheter or straight catheter, sterile gloves, sterile drapes, cherry balls with betadine, 10 cc syringe, sterile water, lubricants, jelly, urine bag, securing tape, and OS pack. So first procedure, prepare the equipment needed. Rationale to promote efficiency. So next, identify and explain the procedure to the patient. Rationale to promote trust and cooperation. So good day, ma'am. Ako si Jumala, ang nurse niyo po today. Ano pong pangalan niyo, ma'am? So ma'am, mag-insert po ako ng catheter, ma'am, ha, para madali lang po kayo makaihi, ma'am. Okay po. So next, wash hands. Rationale to prevent the spread of microorganisms. So next, provide privacy to the patient. Rationale to protect the client's anonymity. Next, assess the client to an appropriate position and drape all areas except the perineum. For female, dorsal recumbent position. For male, supine with legs slightly abducted. Rationale to relax the muscle and allow visualizations of the area to facilitate the insertions of the catheter. So ma'am, pakitaas lang po yung legs niyo, ma'am. So next, establish adequate lighting. Rationally, good lighting is necessary to see the perineum clearly. So next, prepare the catheterization set and arrange the sterile field. Rationale, placement of equipment in order of use, increase the speed of performance, and decrease the risk of contamination. Set up the receptacle for soil items. Rationale to facilitate systematic actions. So next, put on a sterile glove on the dominant hand. Rationale to prevent contamination. So next, prepare the lubricating jelly and cherry balls with betadine. Rationally preparing the equipment enhance the speed of performance. So next, put on sterile gloves on non-dominant hand, rationale to prevent contamination. So next, for an indwelling catheter, attach the syringe and test balloons by instilling 10 cc sterile water and deflating balloon by withdrawing the water. Rationale to check for the balloon patency and defects in the catheter. So next, if the drainage bag is in the set, connect the distal end of the catheter drainage tubing. Rationale to prevent urine spilling from collecting container with performing the procedure. So next, for female, clean the perineum using the cherry balls with betadine solution. The first labia, the far side, second labia, the near side, and the middle, the middle side. Rationale to remove dirt and minimize the risk of urinary tract infections by removing the surface pathogens. So for male, use a non-dominant hand to grasp the penis just below the glands. If necessary, Instruct the foreskin. Hold the penis firmly upright with slight tension. With uncontaminated dominant hand, cleanse meatus with cherry balls with betadine solution. Using circular strokes, beginning at measures and working outward in a spiral motion. Repeat 3 times using the new cherry balls with betadine solution each time. Rationale, lifting the penis in this manner helps strengthen the urethra and to remove dirt and minimize the risk of urinary tract infections by removing surface pathogen. So next, lubricate the distal portion of the catheter and place on the nearby sterile field. Rationale, reduce frictions and possible irritations as the catheter is inserted. So, next, insert the catheter gently in a rotating motion. Instruct the client to take a slow, deep breath upon insertion. Rationale to relax the sphincter to facilitate the insertions of the catheter. So, ma'am, insert ko na po, ma'am, yung catheter, ma'am. Hinala po tayo ng malalim, ma'am. Okay po, ma'am. So, po, inhale. Exhale. Sige po, ma'am. Continue lang po, ma'am. Inhale. Exhale. Continue lang po, ma'am. Inhale. Exhale. Sige po, ma'am. Inhale. Exhale. Thank you, ma'am. So next, for the male patient, hold the penis at 45 degrees angle until urine flows. Rationale to strengthen the urethra and facilitate the insertions. Now push Foley catheter 1 to 2 inch further to ensure that the catheter will be intact and padded. So, next, inflate the retention balloon with sterile water. Rationale to prevent the catheter from slipping out of the position. So next, slightly pull the Foley catheter. Rationale to check if the catheter is locked in place. Next, if the lock of the Foley catheter is already insured, push 1 to 2 further. Rationale to prevent pressure on the bladder sphincter. So next, remove the drape. Rationale to access the tights. Next, tape the catheter on the thigh of female patient and the lower abdomen for the male patient. Rationale to prevent pull on the neck of the bladder as the patient moves. So next, secure the drainage tubing and place the drainage bag below the level of the bladder. Rationale to allow the bladder to drain freely by gravity. So next, assist the client in a comfortable position. Rationale to provide comfort and safety. So mami, baba na po natin yung legs natin mo. So next, gather and discard disposable equipment. Rationale to prevent contamination. Next, wash hands. Rationale to prevent the transmission of microorganisms. So lastly, document the procedure. Rationale to provide accurate data in the care of the client.